for joining us for this segment of Live Healthy here at Trident Medical Center. I'm Lauren Collar. Today we're joined by Dr. Frank Cuoco, a cardiac electrophysiologist with Charleston Heart Specialists. Thank you for joining us.
Thank you for having me.
Today we're talking atrial fibrillation, and starting at the beginning, what does that mean?
Atrial fibrillation is the most common abnormal heart rhythm that we see, and it's the most common because it happens more frequently as people age. It's very common in the aging population. It's a rapid, irregular rhythm from the top of the heart, and it can do two major things. One is it increases the risk of stroke because the top of the heart is not beating normally, so blood can pool and form a clot, and that clot can break off and cause a stroke. It is one of the most common causes of stroke we see, and it's the most common cause of severe stroke that we see. Also, when the heart is beating rapidly and irregularly, patients can feel short of breath. They can feel their heart beating irregularly in their chest, and that can make them feel poorly. And ultimately, that can lead to weakening of the heart muscle or heart failure as well.
So we talk about the shortness of breath as a symptom. Are there other symptoms, and are there always symptoms?
So the most common symptoms would be palpitations or feeling the irregular heartbeat, but also that irregular heartbeat can be very fast. That can tend to make patients feel short of breath. It can also present as chest discomfort or even chest pain if the heart's under a lot of stress. It can lead to heart failure where fluid accumulates. Also, it can cause marked fatigue.
And it's a condition people need to take seriously. What happens if they leave it untreated?
Well, there's a much, much higher risk of stroke. Atrial fibrillation by itself increases someone's stroke risk by 5-fold. And the risk for serious disability with stroke with atrial fibrillation is the highest amongst all other causes of stroke. So we don't want to just ignore that. Also, as I mentioned earlier, when the heart's beating irregularly, it can lead to heart failure. And so if it goes untreated, patients can develop sometimes irreversible heart failure from that.
All right, Dr. Cuoco, thank you for joining us, and thank you for joining us for this segment of Live Healthy.
Live Healthy is sponsored by Trident and Somerville Medical Centers and provided as a service to you and your family.